Hello, this is Dr. Abdullah from Dr HE Clinic. Today I want to speak about reinforcing the staple line in bariatric surgeries. The characteristics of the staples used in bariatric surgeries are very important in terms of postoperative complications. Three-staple technology produced by Medtronic company provides safe closure of the tissue and reduces complications more significantly. This three-staple technology helps us a good stapling for stomach. This means less complication, less leaks and less bleedings. Different color here. This is the instrument of Medtronic trademark. Different colors we use. There are three lines of staple and a knife middle side of the staple and another three lines of staple here. Before the use of three-staple technology, the question of whether to reinforce it with sutures after performing the surgery with standard staples was on the agenda. The publications in the literature stating the benefit of putting stitches on the staple were made using standard staples. As you see here, there is no bleeding and all the staple lines seem so fine. However, there are many articles in the literature that argue reinforcing stitches on the staples are of no use. In fact, some articles emphasize the harms such as narrowness as well as not being beneficial. Staples produced with three-staple technology are not preferred in some clinics due to their relatively high cost. Since the three-staple is not preferred, it is seen that they emphasize the advantage of reinforcing stitches over the standard staples. In the light of all this information, we emphasize the importance of using three staples in our practice. Since we do not think that suturing on staples routinely has a significant benefit, on the contrary, we do not do such an application because we think that it may cause harm from time to time. Now we finished stapling. As you see, the staple line, there is no bleeding, it's closed safer. Sometimes our patients are confused about reinforcing the staple line. Some clinics advise to put sutures outside of this staple line. We don't prefer this because there are evidence-based information in the literature that sometimes the reinforcement sutures will cause stenosis in the sleeved stomach. And most of the publications that advises reinforcement over the staple line were analyzed with other staples. Three staples were not used at that studies. So, according to we are using three staple, a safe trademark with Medtronic. We don't prefer to put reinforced sutures for safety of the patients. Most publication recommends that there is no change about complication with reinforced sutures or no reinforced sutures. Thank you.